Hey, this is Dr. Berry. In this short video, let's discuss the best diet to help prevent and treat benign prostatic hypertrophy or enlargement of the prostate gland in men. There are millions of men, both diagnosed and undiagnosed, who suffer from an enlarged prostate and all the symptoms that can go along with that, from urinary retention to dribbling to hesitancy to erectile dysfunction. These are all big deals for guys with BPH. And so that's what we're going to talk about in this short video. If you know a gentleman who suffers from an enlarged prostate or BPH, please share this with him on his Facebook page, send him an email, send him a text, share it on his Instagram, because so many men don't really realize they can actually have an effect on this by changing their diet. And that's what we're going to be talking about. So let's dive right in. So there are millions of men who are affected by this, and it can lead to severe kidney problems as well as prostate and erectile problems. And so it can actually become a medical problem if it gets severe enough. For years, we were taught as doctors, we don't really know what causes this. We think it's just because you're getting older. And so then I found out this little interesting tidbit of trivia, and it's not really trivial, but the only two species of mammals that suffer from BPH or prostate enlargement are human beings and domesticated dogs. So coyotes and foxes in the wild don't suffer from this, but domesticated dogs do. Now, I guess you could try to make the argument that it's somehow related to their breeding or crossbreeding, but I don't think that's what it is, because humans and domesticated dogs, we don't really share that much DNA. And so I think maybe it's our diet, because domesticated dogs eat what we feed them. And over the last 50 years, that hasn't been the greatest diet, has it? And so let's talk about the two key things in the diet and in your body that can contribute to enlargement of the prostate and the symptoms that go along with that. So, first and foremost, there's actually quite a bit of credible medical research that shows that if your insulin level is chronically high, either because you eat a high carbohydrate diet, because you're pre-diabetic or type 2 diabetic, or because you take insulin, inject yourself with insulin every day, that has a direct effect on prostate enlargement. And I'll post a link to the studies down below in the show notes so that you can check that out yourself. But this has actually been known to medical science for a minute. But until doctors start to shift their paradigm that diet actually matters, it doesn't really make sense. Like, I don't know, high insulin, I don't understand. But now it makes perfect sense when you start thinking about an ancestrally appropriate diet and how that keeps your insulin level naturally lower, both in humans and in domesticated dogs. Then immediately you start to see, oh, okay, so it's the inflammatory, hyperinsulinemic standard American diet or standard Western diet. That's what's keeping all of our insulin levels chronically elevated, because we're told to eat all these whole grains, we're told to eat all these fruits, and this keeps our blood sugar spiking continuously, which keeps our insulin spiking continuously. And with that chronically high insulin every single day for years and years, that leads directly to prostatic hypertrophy or enlargement. And so that's the number one thing, is you want to eat a diet that keeps your blood sugar levels as low normal as possible, and that will in turn keep your serum insulin level as low normal as possible, and that will greatly diminish your prostate enlargement and perhaps even reverse existing prostate enlargement. Big deal, right? So the second thing I want to talk about is testosterone. A lot of people are under the false assumption that increasing testosterone levels causes prostate enlargement, but the opposite is what's actually true. And a good common sense mental exercise for this is just think back to when you were 18 years old, you and all your buddies hanging out, right? How many of you guys had an enlarged prostate? None, right? None of you guys. You had no problem urinating. You had none of the symptoms of an enlarged prostate, even though your testosterone was sky high. And so now that we come back and look at this issue with fresh eyes, it looks like that as you get older, your testosterone level goes down and your estrogen level, relatively speaking, goes up. That's probably what leads to the enlarged prostate. And so the standard American diet of lots of carbohydrates every day keeps your insulin level high. And then also eating that sort of diet also causes your testosterone levels to be prematurely low. There you go. That's the perfect storm for having an enlarged prostate, both in human beings and in the domesticated dogs who we are responsible for feeding the crap diet that they've also been eating for the last 50 or 60 years. Okay. So as you get older, your insulin level tends to go up. That's just a known thing. It gets worse immediately with an improper diet. So I would highly recommend you eat either a ketogenic diet, a low carb, high healthy fat diet, or even a carnivore diet to stop any prostate enlargement you may be having and perhaps even to reverse existing prostate enlargement. I would recommend that you keep your insulin levels as low normal as you possibly can, both with your diet and then if you are a type 2 diabetic or even a type 1 diabetic, slowly but surely decrease your insulin use as much as you possibly can. Hopefully, a type 2 can completely stop any insulin injections. A type 1 diabetic won't be able to stop them, but they can greatly decrease the amount of insulin they need by improving their diet and moving it towards a ketogenic diet. Then also you want to keep your testosterone as high normal as you possibly can, and you'll do that with diet. Some guys may have to get their testosterone optimized with a bioidentical hormone, testosterone, and I think that's entirely appropriate if your testosterone level is too low. And then you want to keep your inflammation levels in your body as low as you possibly can, both by eating an uninflammatory diet like keto, by living an uninflammatory lifestyle, and by not taking or doing or ingesting anything that's going to increase inflammation in your body. Now, if you enjoyed this video and you'd like to see more like it, click that subscribe button. It's right down there, I think, and click the little bell right beside it. So every time I get a bright idea, you'll be one of the very first people to know. Also, check out my Facebook page and Instagram page. I do a lot of work there. And if my videos have helped to improve your life, you can help me out to have more time to make more videos by clicking on my Patreon link. It's right down below. It's a quick sign up and you can throw a buck or two my way to help me have more time to make videos just like this. This is Dr. Berry. I'll see you next time.